Welcome back to Houston Life. If you've been dealing with joint or nerve pain, even the simplest daily activities can become painstakingly difficult.
Instead of medication and surgery, doctors at NexGenEsis say they can use the patient's own biologics to put the body in the best position to heal itself. Mel Camp has more.
You may know the doctors we're about to speak to, Dr. Joe Furman and Dr. Abhishek Reddy from NexGenEsis Healthcare. Now, normally they are in the Houston Life studio, but today we have come out to their clinic in Bel Air to learn more about how they're helping their patients find relief from joint pain and nerve pain like neuropathy. So, ready to learn more? Let's head on in.
You know, we focus on joint and nerve pains. And what we do is utilize the body's own natural healing powers to essentially heal itself, you know, without the use of medications, surgeries, steroid injections and gels, you know, so that they can be put in the best position to, again, heal themselves.
So you help people with joint pain and also nerve pain. Neuropathy is nerve pain, isn't it?
That's correct, yeah. Neuropathy is essentially just nerve damage, right, where the nervous system is just not functioning at its optimal level. And that's kind of where we come in and help the patient get back to where they want to be.
What are traditional treatments for neuropathy, and how do you guys do it differently here at NexGenEsis?
So traditionally, patients will go to the doctor and they may be prescribed things like gabapentin or Lyrica, which are medications that don't really do anything to fix the actual nerve damage, right? They don't work to reverse it or anything like that. And what we do here at NexGenEsis is different because, like I said earlier, using the body's own natural healing ability to heal itself. Lots of different treatment options that we provide here, just depending on the severity of the case, things like laser and light treatments, acoustic compression, nerve plates, nerve reeducation, supplements, even the patient's own biologics, things like PRP or platelet-rich plasma to, you know, again, put the body in the best position to heal itself.
Wow, it's really amazing how it works. I mean, how do we know that we're suffering neuropathy? How do we know that it's time to come in and visit you guys?
Yeah, so common symptoms with neuropathy are going to be like numbness, tingling, burning, maybe swelling, typically in the feet, legs, and hands. Balance issues are also very common when it comes to nerve damage in the feet. So if you or if anybody is experiencing any symptoms like that and they're continuing to progress, that's always a sign that you definitely need to get that checked out, because unfortunately neuropathy, it tends to progress and get worse over time, and it can lead to really severe debilitation to the patient and even amputations.
Wow, and that's something that happened to your grandmother, wasn't it?
Yes, yeah, absolutely. I did see my grandmother go through an amputation of her foot, and then her leg as well. She was diabetic and got a severe sunburn. It got infected. They ended up having to take her whole leg. So I saw firsthand, you know, her quality of life, right, go down the drain once being in the wheelchair.
And you're really able to help your patients now.
Yes, absolutely.
Make a difference.
Yes, ma'am. Yes, ma'am.
And for Dorian Castro, he came to you with back pain, but he also had neuropathy.
Yeah, correct. So he had a little bit of both, you know, a little bit of back symptoms as well as the neuropathy coming down the leg, and he was having a lot of trouble with sleeping and getting around like he wanted to, and we were able to help him with some different treatments that we provide here, and you know, he's been doing great.
I was miserable. Man, I couldn't sleep at night. I was having that neuropathy and that twitching in my leg, keeping me up till 2 in the morning, 3 in the morning, you know, and it was just miserable. You don't get a good night's sleep, you just can't function the next day, and it's horrible.
And you had really bad back pain as well.
And lower back pain with the arthritis, it's just awful.
When Mr. Castro came in, did you know right away what it was that you had to do?
Well, we had some imaging and we kind of saw that he had that arthritis in the lower back. He was complaining a lot about that lower back pain, and then some of it going into the legs as well. You know, we just kind of used his own biologics, so meaning we took out his healthy cells, growth factors, and molecules, and we kind of reintroduced them back into that area to kind of help heal itself. And this really helped ease up a lot of his symptoms, if I'm not mistaken.
Mm-hmm. Yes, it did.
That in combination with some of the advanced therapies that we use, you know, now he's sleeping better, he's moving better.
Before you came here, your pain level, where was it?
Pain levels in the 9s,
Wow.
not 10s.
Wow.
And I got some relief after the second day of the injections.
Dr. Reddy, you helped Mr. Castro with his neuropathy and also with his joint pain. What are some of the joint pain problems that people come to you to get helpful?
Yeah, so a lot of times, or most of the times, patients come to us with osteoarthritis type joint pain. This is that normal wear and tear, that breakdown of that joint space in the cartilage. It leads to bone-on-bone friction, can lead to a lot of pain, decreased mobility, and decrease in functional status for these patients, really affecting their quality of life.
So you really are providing people with some great options when it comes to finding relief from pain. What would you say, Mr. Castro, having been through what you went through, being in as much pain as you were with that lower back pain and down your leg, what would you say to someone who's in pain right now and wondering if this is the right treatment for them?
I'd say give it a try before the pain gets to where you can't manage it. I know I was prescribed some medication that, wow, it was just overwhelming, and then I knew that I had to do something. Remembered your phone number and gave the doctor a call. Yeah, don't wait.
And in case you're wondering, NexGenEsis does have a special for Houston Life viewers today. If you're one of the first 50 callers who mentions Houston Life, you will receive a free phone consultation with the provider to determine if you're a candidate for an in-office examination.
Their number is 832-570-4529. You can also find out more online, NexGenEsisHealthcare.com.